data, we would have had people who would unknowingly potentially bring virus to their loved ones, to their immunosuppressed loved ones. We felt it a moral imperative to inform the American public as soon as we knew and publish the data as soon as we could within 3 days of our guidance.
Yeah, so that's really important to get that information out there. Do you think the CDC and others, for example, got the messaging wrong when it comes to breakthrough cases, people who are fully vaccinated but get COVID? Experts have repeatedly insisted that breakthrough cases are rare, almost dismissing fears, but wouldn't it have been better to give a more nuanced explanation about what to expect?
I think we all have to recognize that with 164 million people who are vaccinated, we should expect tens of thousands, perhaps, of breakthrough infections. But the most important thing is not the number of the breakthrough infections, but what happens here. Those breakthrough infections have mild illness. They are staying out of the hospital. They are not dying. And I think that that's the most important thing to understand. We have a massive number of people who are vaccinated, and those breakthrough infections tend to be mild and not severe.
But what about all the fully vaccinated people who get the breakthrough infection? Can they pass it on? Could they pass it on to their children? Could they pass the virus on to older people, especially more vulnerable people with underlying health conditions?
And that's exactly the point that we made in our guidance. So yes, they can with the Delta variant, and that was